Hello everyone. Today we are going to talk about a very important topic, that is sudden cardiac death. And since we all know that the famous singer KK has passed away after a sudden cardiac death here at the heart of our city, Kolkata, there is a sudden surge in knowing about sudden cardiac death. I pay my tribute to the famous singer, and I would like to educate the masses about how to know the signs and symptoms of sudden cardiac death, and obviously the treatment and how to prevent them. So, sudden cardiac death is defined as something which happens within a very short period of time, likely period of 1 hour, where there is a massive arrhythmia which leads to sudden stoppage of your heart. This could be well because of two very common reasons. The first reason being you have coronary artery disease. In layman terms, you have a significant blockage of your artery in one of your arteries of the heart, or you might be having a heart failure for pre-existing some long time with a reduced pumping function or ejection fraction of the heart. So both these conditions can suddenly lead to tachyarrhythmias, that is increase of the heart rate, which goes well beyond the tolerable normal limit, and suddenly because of that there is a drastic reduction of the blood supply to the brain, leading to sudden catastrophic incidents of sudden cardiac death followed by sudden cardiac demise of that individual. The next important point which comes is how do you know or how do you prevent it? So, sudden cardiac death is actually preventable in many of the situations if we follow these rules. Usually, in like 50 to 60% of the cases, it is found that a person who is about to have a sudden cardiac death do have some prodromal symptoms for the last 2 to 3 days in the form of maybe chest heaviness or discomfort or sweating or actually not feeling well. So either of these could lead to your warning signs that the person is not doing well. And if a person already has a heart disease or already has a previous history of heart attack or a previous history of coronary angioplasty, bypass surgery, or a known case of heart failure, you should be very cautious regarding these symptoms. How do you prevent them? If you want to prevent a sudden cardiac attack, it is very difficult because you don't know at what point of time it's going to hit you. But as a general awareness, what we need to know, the need of the hour is knowing CPR, that is cardiopulmonary resuscitation. As a general individual, if a person falls down unconscious, is barely breathing, is not talking at all, the layman person who has found him like that should know how to do a CPR, how to resuscitate a person using nothing but chest compressions and mouth to mouth breathing. So that is the need of the hour. And obviously, your medications should be always with you in case you are traveling anywhere, in case you have some scheduled plan in front of you. And needless to mention that your regular checkups with your doctor, cardiologist, physician should always go on if you are already a known cardiac patient. So that was all about awareness regarding sudden cardiac death and how to prevent that. Thank you.